Castanet. I'm going to explain sciatic pain to you today. Sciatica is pain in the distribution of the sciatic nerve. The sciatic nerve is a very large nerve, the body's largest nerve that starts in your buttock region. It is made up of 5 nerve roots in your lower back and the sacral area that come together in the upper buttock region, and the nerve continues all the way down to the foot, dispersing branches throughout the lower extremity, including the buttock, thigh, leg, and foot on its way down. These nerves are responsible for your sensations, your reflexes, and your motor function in the lower extremity. The cause of sciatica is almost always a disc problem, meaning a bulge or herniation that puts pressure on one of the nerve roots that contributes to the sciatic nerve. So it could be an L4 nerve root compression, L5 or S1. Those are the most common ones involved in a disc herniation. When discs herniate, they typically, in fact, I'm going to show you a model here for the moment. This is an example of 2 vertebrae with a disc in between and a disc on top. There would be additional vertebrae on top like this, but I'm going to remove these for the moment, and I'm going to turn this on end. This is supposed to represent a disc herniation. This disc herniation, as most disc herniations, migrates towards the back where the nerve roots exist. The nerve roots are present on either side, and if they're compressed, they will give rise to pain wherever this nerve root goes. And as I said before, these nerve roots that make up the sciatic nerve run down your buttock, thigh, leg, and foot, and as a result, that's where people typically feel pain. The pain is typically progressive in its distribution further down the leg as the problem gets worse, and as you treat and improve the problem, very often the pain will recede in the opposite manner or the reverse fashion, improving first in the leg and foot, and then in the thigh, and last in the butt and the back area. The best way to treat this problem, because it's a compressive problem, meaning that as these discs degenerate and bulge out and collapse, that's a compressive lesion. The best way to treat it is to put the person on their back on a table. These tables are essentially traction tables that I use, but much more sophisticated traction. Traction has fallen out of favor for a variety of reasons, including the fact that most traction tables are rather crude. They're not comfortable on the patient nor easy for the practitioner to use. They remain, however, on theoretical grounds and in reality, with the use of a competent, effective table, the most effective way to treat this problem. So I place the patient on a table, face up. It's very comfortable. I secure parts of the table to the anatomy of the patient, and very gently the patient has their vertebrae gently pulled apart. That reduces the pressure within the disc. That provides a mild impetus to get the disc to return back toward its origin and get off of the nerve root, which is pinched and the source of the pain. Typically, 80% of patients, the first treatment will get some relief. Some will get significant relief from the first treatment, but it's usually then a series of treatments that varies widely. I've had patients improve from this and resolve their problem within several treatments. Other times it could take, on rare occasions, 20 or more treatments, but it remains the most effective way to non-surgically treat this problem. And it's an alternative for surgery oftentimes, and an alternative to pain management, meaning injections oftentimes. Additionally, because it's using mechanical means to treat the problem, when you improve, you know that you've actually made the anatomical physical problem better. And that's good to know, because that means, in all likelihood, at least on theoretical grounds, you are prolonging the painless lifespan of your spine and prolonging the painless lifespan of your spine as long as possible. It's the best way, in my experience, to manage these problems over the course of a lifetime. It makes the most sense, and in fact, as a practical matter, it's more effective than other non-surgical means of treatment. So I highly recommend it if I can help you with your sciatic problem, which I treat all day long every day. My number is 404-558-4015. Thank you.